Hello, good evening. I'm Dr. Rajasekhar Pappuu. Today we're going to talk about plantar fasciitis. So, plantar fasciitis is actually it is a heel pain. In colloquial terms, we call it as heel pain. This happens because of inflammation and also micro tears in the plantar fascia. Plantar fascia is the one which supports the arch. Arch means when you have in a foot, when you stand up, the medial side arch of the foot forms a slightly arch type thing like this. So an arch is formed. So it won't allow it to become flat. So that is mainly maintained by the plantar fascia. Whenever there is a stress on plantar fascia, whenever there is stress on the plantar fascia, you will have some pain over here. That is called heel pain. So what are the main symptoms of plantar fasciitis? So usually have sharp stabbing heel pain is a very late symptom. That's not present in all everybody, but you will find it very commonly in very late, very severe cases of plantar fasciitis. Mainly, in the initial stages. You will have pain after rest. Suppose you sat for 5 minutes or 7 minutes, 10 minutes, or you sat for few moments and then you started walking. You will have pain in the heel. That is only for few steps initially, but with time passing by, you might have that pain for longer periods. So that means it is becoming more severe and severe. Initially, you will not have so much of pain. It is only dull aching pain, but when you slowly it becomes very severe. And pain is the activity. Suppose if you are playing any games, cricket or any other game, you will have very severe pain while running, jumping, and all that. So these are the activities which increases the pain. And also you will have tightness in the Achilles tendon and tenderness in the arch, because whenever there is Achilles tendon tightness, you will have more stress on the plantar fascia and you will have plantar fasciitis. What are the causes and risk factors? So it is manaki usually it is overuse. That means you are standing for longer periods. If you might be a sprinter runner, if you are running more and more barefoot on the roads, not on the ground, so you'll have this pain very excessively in those patients. So high impact activities. So these are the runners, dancers, and high jumpers, and also pole vaulters. These all uh, sports where you'll have pain, mainly long jump, where you'll have where you land on your heel, and also sports like running. So you might even have sometimes fractures, and jobs requiring long-term standing jobs. And another thing is obesity. If you are more fat, if you are overweight, also that causes more pressure on the heel and that causes plantar fasciitis. And last but not least, there is foot mechanics. So whenever there is tightness in the Achilles tendon, whenever there is tightness in the gastrosoleus muscle, you will have pain in the heel. So this will cause much pressure on that. Also, you have cavus foot where arch is very high, heel arch is very high, that will cause pain in the plantar fascia. And also, if you have any inflammation or any infections around the heel, you will have pain in the plantar fasciitis. And another thing which causes the most common cause of heel pain is a new shoe. So you are wearing one type of shoe every day. Suddenly you bought some new shoe where the sole is very hard and tough. So this very hard sole will cause irritation because you are not used to this new shoe. So it has to adjust. Because of that acclimatization period, you will have some pain in the shoes and the heel. So slowly that will go. But if it is pathological, it will not go. So diagnosis, when it comes to the diagnosis, we have to think of diagnosing it. First thing is we have to take an X-ray of the heel in lateral position. What do we see on heel X-ray? You will see usually spur in the calcaneum. This spur, many people think that this spur is the one which causing the pain, because a spur is a beak-like thing which is present at the bottom of the heel. So this spur, many people think that this spur is the main cause, but spur has no role in plantar fasciitis. Why do we many people have spur then when there is no role for it? They will have spur in the heel because that plantar fasciitis, whenever it gets attached, whenever there is some pressure on it, so it starts tearing in it. So these micro tears of this plantar fascia leads to inflammation, and that inflammation gets calcified. Because of that, you will have some spur formation. Otherwise, spur has no role. It will not cause any pain. It is only the inflammation in the plantar fascia at the heel area. You will have pain. So there will be before going ahead with treatment and all that, we should know what all other causes mimic plantar fasciitis. Suppose if somebody is having uh, tarsal tunnel syndrome. Tarsal tunnel is there is a tunnel called tarsal tunnel where tibial nerve, posterior tibial nerve, and posterior tendons all pass through the tunnel. So whenever there is any increased pressures within the tunnel, that causes compression of the posterior tibial nerve. So this posterior tibial nerve gives descending branch to the plantar fascia, which gets compressed, calcaneal nerve. So this calcaneal nerve gets compressed and you will have pain. So it is very important for us to rule out uh, plantar fasciitis because of tarsal tunnel syndrome. Second thing is whenever there is severe disease, what is this? You will have gastro muscle tightness. So most of the times in many people they will have gastrocnemius, tightness, spasm. So because of that, you will not have complete dorsiflexion. Whenever there is no complete dorsiflexion, you will have more pressure on the plantar fascia and you will have pain. So whenever there is any problem in the pathology of muscles, that might cause because of backache, where you have spasm or primary spasm also. So these people will have mostly whatever. Whenever they come to you, they'll come with pain for 3, 4 months, 6 months duration of pain. Maybe most of the times these people will have only one-sided pain. It's not even both sides. So usually plantar fasciitis, classical plantar fasciitis is two-sided pain. So if somebody is coming to you and telling you that they have pain only on the one side of the leg, either right or left, and that too for longer periods like 3 months, 4 months, you have to think that the cause is not in the heel, it is somewhere else, which is causing the pain here. So you have to always diagnose the primary cause of the disease and then treat plantar fasciitis. Otherwise, patient will not get relief. How much ever physiotherapy you do, how much ever you give, what do you say, physiotherapy, medication, whatever you give, patient will not have pain relief. He'll be roaming and changing the doctors, but he will not get relief. So, whenever, we have to always rule out this plantar fasciitis because of this. And sometimes some people will have infections at the plantar fascia that also causes plantar fascia mimics plantar fasciitis. So you have to always check for infections in those areas. So next is treatment for plantar fascia. What is our main treatment? The most important treatment method is conservative method only. We give medication, and then we'll give some rest, and then we'll give some orthotics which will relieve your offload your heel. So whenever there is a pressure over that or very hard shoe, will give some soft gel foam so that you will not have pain in the pressure over the heel and then pain. Another thing is physiotherapy. So first thing is analgesics, pain medication. Second thing is orthotics. Third thing is physiotherapy. What do we do in physiotherapy? We mostly give you ultrasound therapy or shockwave therapy or diatherapy. Shockwave therapy will give. So because of that, the inflammation will come down, and then you will get pain relief. In ultrasound therapy, we add some medication also. So this ultrasound therapy, when you add medication to it, it will act like iontophoresis. Because of this iontophoresis, medication locally will go into the tissue inflamed area directly. So it will have some higher concentration in the inflamed area. You can give most of the time steroids also in this ultrasound therapy because whatever you do in ultrasound therapy, add these drugs, they will not have systemic effect. So steroids are not that good for systemic body. So when you are giving ultrasound therapy with steroids that will take care of the inflammation in the local area without any systemic effect. Another thing is that you have to rule out diabetes, uric acid, and other problems, tendon problems, all that after treatment. If there is an infection, you have to give them antibiotics. So most of the times, whenever you bought a old chappal which is worn out, you'll have pain. So new chappal, if it is new chappal, we give some time before treating. Some and also we'll give insoles like heel, cushion pads, and all that to relieve your pain. In severe pains, we'll give medication analgesics. Usually it takes 3 to 4 weeks for it to come down. Only in some secondary plantar fasciitis only this pain will be for lengthier periods like 3 months, 4 months. Sometimes they will have pain for 6 months also. So, what are the other methods of treatment? We have surgical methods. So, whenever your conservative methods fail, we approach for treating them in a conservative. Whenever conservative methods fail, we approach try to deal this with surgery. So there are many methods of doing surgery. One is endoscopic plantar fasciotomy, where a scope is put inside and then slowly partial only. You cannot do complete plantar fasciotomy. You have to do only partial, little bit medial side. You remove it, and then you have to rule out tarsal tunnel syndrome, and then also you have to rule out secondary uh, tightness of gastrostomach only after that. So if there is any pain because of gastrosoleus tightness, you have to do release of the gastrocnemius muscle. Another thing is that if it is endoscopy is not done by everybody. So you can go for open surgery. Traditionally, we'll do an incision on the medial side of the sole. We approach it through the sole and then cut the plantar fascia medial side, allowing the surgeon. And then gastrocnemius restriction, we already discussed about it. And there are some procedures which uses ultrasonic therapy to remove scar. So what is the recovery and aftercare after surgery? So recovery time, most patients return to normal activities in 3 to 6 weeks. You have to give them some rests initially because you have operated it, and then you do physiotherapy, plantar fascia stretching exercise. While walking, you give splint or some cushion inside the shoe so that they will have some offloading of the heel. And also you have to do physiotherapy like plantar fascia stretching exercises and then ultrasound therapy and all the other physics. So what are the risks and success rate of this surgery? So whenever we operate, so we very rarely operate in India for plantar fasciitis. I have operated only one case in my last 20 years, but most of the times it is conservative treatment only. So it is 87 to 90% success. So even with surgery also you will not get 100% success rate. It is only 87 to 90%. What are the risks and complications? Complications are rare but include infection, and sometimes Baxter nerve will be there. That is a descending calcaneal nerve that might get entrapped or injured. Because the sole is thick, skin is very thick. Sometimes it heals very slowly, so pain might not be complete. So these are the risks of plantar fasciitis. Thank you.